Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. So today's topic, we're going to talk about patient portals. Technology has taken off so fast in healthcare, especially since I've been in the last 20 years. I remember paper charts and everything. Now everything is so electronic, so at your fingertips. And one of the things that have also sprung out of all of that are patient portals. Not all EMR software offers patient portals, but most of them do, or they are an extra maybe charge for the practice to offer to patients. I strongly encourage you to consider adding that on as a feature if you have not already. We're going to talk about why in this video patient portals can be so beneficial. Yes, there are some downsides, but I still feel that overall the benefits outweigh the negatives. Obviously, it's your decision as a practice manager or owner to decide if the benefits are better for you or not. But we will talk about everything today, and hopefully this will help you make that decision. Patient portals. Basically, it is an electronic way of communicating with your patients and offering them access electronically through the internet of all of their chart information. That includes billing information, messages, progress notes, lab results, diagnostic testing results, and a way for you to know that patients can see their information whenever they want, 24/7. It's available at their fingertips. It's one of those things that improves patient satisfaction a lot of times, because instead of them freaking out and thinking that things haven't come back yet or the doctor's not paying attention to me, they can log into their portal and confirm some of the things that they're worrying about. One of the biggest benefits of a patient portal is patient communication. Not only is it HIPAA compliant, which is huge because honestly, using Google or your Outlook in emails to discuss things with patients is not HIPAA compliant. And I know that some of them say that they are HIPAA compliant, but honestly, I don't trust that. And I'm not willing to take the risk and the penalties for communicating and putting PHI and PII out there in unencrypted emails to patients when I can use a platform that is very HIPAA compliant because it's designed to be, and it's designed to be used in the capacity it's being used. General email is not. So if you are using general email to communicate with patients, and I don't care if it's them sending you their insurance cards, them confirming a scheduled appointment, whatever it is, I highly recommend to stop that practice. Whether you want to adopt a patient portal or not, I would consult with a healthcare attorney just to make sure that you're following HIPAA guidelines and privacy policy, security policies, because I would hate for you to be having good intentions to communicate with patients on their side. It's easy for them to email you, but you to be in violation of anything. So anyways, back to messaging. It is very, very convenient for patients because no matter what time of day, if they think of something, they can get on, they can email you, essentially is what it is, through the portal, and you will get a notification, or whoever on your team it is routed to will get a notification that a new message is there. And usually there's a tracking system, it's all documented, it's logged. It's very, very helpful for administration to see productivity and to see how long things have been sitting there. A lot of times, if it's in a general inbox, not just one person is responsible for checking it, you can have other people making sure it's getting looked at and responded to. It's very, very convenient for both the patient and for the practice. Prescription refill requests. A lot of times, if a patient needs a prescription refilled, instead of calling the pharmacy, they will try to call your office and say, I need a prescription refill. Some medications you have to do that, right? Like controlled twos probably. But if they have access to their portal, they can do a prescription refill request through the portal, making it less time for them to get on the phone to call your office, less time for your office to have to take that message and put it back to the right staff member. And it can be done just in one fell swoop. It can be done on weekends, it can be done in the evenings. Someone on your side, if they're responsible for checking certain times of day when you're not in business to do that, or on the holidays especially, it just can be responded to and done. Boom, it's all there. And when that request comes through, the refill obviously is going to be generated through your EMR system to the pharmacy. So it's just all in one place, and you're not trying to fumble through phone numbers and making phone calls and taking notes and responding to the notes and making someone else call the patient back. It's all in one place. Some patient portals also offer a telehealth platform, again, following HIPAA guidelines for telehealth, and it is going to be HIPAA compliant. It's all in one place, so it makes it easy for the patient to know where they need to go because they're most likely familiar with the patient portal. They can see that there's a telemedicine option, and you can communicate to the patient about their telemedicine appointments through the portal. So it's all in one place, and people aren't trying to check their personal email and use a Zoom platform or log into this platform, even though you use this EMR. A lot of EMRs might even do transcripts for you. I don't know, but that would be really nice to help with your charting after the visit. There's so many perks of using a telehealth platform within your patient portal, within your EMR. It's just so efficient. That is another big perk of a patient portal, especially if there is an option to offer telemedicine through that as well. Patient payments. We know that collecting from patients is very hard these days. And the easier we can make it for them to pay their bill, the more likely they are going to pay their bill. We also know that people aren't as good at checking their paper mail as they are their electronic mail or electronic notifications, such as a text message. Now, there are so many platforms through patient portals that will notify patients of their balances through a text link, through an email link, through a portal message, where they would just have to log into a portal to pay their bill instead of trying to grab their mail out of their mailbox, opening it up, looking at it, and dealing with it. Because I'm going to be real, when I get those paper ones, I put it off to the side. I don't do it right away. And sometimes it could get forgotten. I love the text messages that I get when they know I haven't paid my paper bill in so much time. I get a text message. This is from like LabCorp or Quest. They'll send me a text message and they'll say, oh, you have a $28 bill due. And I'm like, oh, yeah, that's right. I got something in the mail. But I just do it right there on my phone. I go, link, confirm my personal information, my last name, date of birth, whatever they need, shows me my balance, put in my credit card, boom, I pay the bill. It saves them on the cost of having to send another paper statement, which are expensive. It's fast payment for me to get out of my peace of mind, right? And for them to receive that money. So patients being able to log into their patient portal to check how much they owe, to be able to pay their balances, for you to be able to communicate with them about their accounts is very important. Like maybe they're past due or they haven't paid for a while. If you need to send them a notice, you can send it electronically. It's all documented, it's all logged, it will all be saved. So if you send them to collections, you can say, well, we sent them this message on this day at this time via this communication. It's all there. It's so nice. Instead of old school, writing it all down, making copies of it, putting it in their chart. This is a huge one. This is one that I think pays for itself. I think it's an ROI. If you do have to pay extra for certain features or the patient portal, that if you have the feature for paying the balances, patients paying their balances, the return on investment, in my opinion, is definitely worth it. The other benefit of patient portals is blast messages, like sending out promotions, whether it's we have our flu shots in, come in and get your flu shots. It's Are you due for your wellness exam? A lot of times you can set them up that your system will see that it's been a year since their last wellness exam, if you're like in family practice or internal med, and it will send them a notification that says, hey, your last full physical was a year ago. We need to get you scheduled. Sometimes they can schedule right there from links, other times they can't. That's definitely something as a preference of the practice, whether you want to allow patients to schedule online or not. I think having some urgent care or some same day appointments reserved every day, depending on your specialty, of course, reserved for online scheduling for after hours or something is very appropriate. Patients like that a lot, especially if it's a pediatric office or family medicine where a patient gets sick in the middle of the night and they feel horrible and they just want to make sure that they have an appointment with their doctor. They can go online to the portal, they can schedule, and they know they'll get to see you the next day. And you get that business instead of them going to urgent care or emergency room. So again, that's a little side panel there of patient scheduling, but the promotions that you can send out are very, very good. Inclement weather, closures, power failure, you have to close, something like that. You could send out a mass text message or email to patients on the schedule saying, hey, such and such happened. We are closing early today. I apologize. Somebody will be reaching out to reschedule you. Or we are closed today due to the weather. Somebody will be reaching out to reschedule you. Something like that, instead of taking your staff time to individually call and communicate that message to everyone on your schedule. Again, the scheduling feature is very nice. That's definitely a preference for your individual practice and things to consider. I already mentioned those, but those are some perks of a patient portal as well. So we've talked about that, but what does all of that do for you as a practice owner or manager? Well, you get increased patient engagement, which is fantastic. Your providers might feel really happy because maybe patients are more likely to be involved in their health care because they can communicate so easily with their provider about changes to their treatment plans or their medications or reactions that they're having or just updates on how they're feeling. If it's easy, patients are going to be more likely to provide that information, which means the provider can make changes to their care more quickly and hopefully get them on the right track faster. You have increased patient satisfaction, like I said. You have increased staff satisfaction because it's more efficient. Their workflows are maybe not as complex or they're not as broad. Maybe they have less on their plate because of this whole feature. And then you're going to have less administrative burdens, which hopefully will reduce your administrative overheads, and you will see it in your financial pocketbook that these efficiencies are actually costing you less money. To me, running a practice, there are two big things I keep in mind. One is going to be the costs and the overheads with efficiencies and workflows. And the other is going to be the patient safety and satisfaction part. If you can find a happy medium to bring those together and to work well, which patient portals do, you are going to be really knocking it out of the park, hopefully financially. And with the patient satisfaction, patients are happy with their care. They're going to tell their friends and family about how they love the care they get at your group, your clinic, with your providers and your staff, and you're going to grow your practice that way. So keep that in mind. Word of mouth is very powerful marketing, and it's honestly, I think, the best, especially in healthcare, because people want to go see providers that the people they trust. And if they're talking really good things about your practice because the providers are good at communicating, it's ease of communication, the staff are good at communicating, they're getting what they need, they're feeling good, it's all going to benefit you in many, many ways. Not only with the satisfaction of doing good patient care, but also hopefully that, like I said, financial are going to be improved as well. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you have not already, and please share this with your colleagues whom you feel would benefit. We will see you next time. Take care of yourself. Bye-bye.